Like the rest of the country, the people of Wakefield are adapting to the new normal. But this is a city that's now identified as an area of concern following a recent rise in the number of positive tests for COVID-19. A possible candidate then for the implementation of the new powers given to local authorities to implement local lockdown measures.
They will have the powers and they will be able to act immediately wherever that's required. So that's a matter for them locally, working with Public Health England and others, but the powers will be there.
Health experts in Wakefield say there's no need yet for what the Prime Minister calls a lightning lockdown, but are urging people to remain alert, wear face coverings in enclosed spaces and continue following social distancing protocols. Meanwhile, they'll continue monitoring the situation.
Just for the last couple of weeks, we've been able to get the level of data that we require to manage outbreaks successfully at a local level. And my team have developed a very comprehensive early warning system, which not only looks at postcode data, but things like phone calls to your local GP. We even track social media coverage on that. So that's a very robust mechanism to ensure that we are absolutely on top of it and we understand if at any point we have any concerns.
Although the accuracy of data given to local authorities has been greatly improved in recent weeks, there are calls for it to be made even more detailed.
Number one is named patient data. A postcode can take you to a general area. A name takes you directly to the source of the outbreak, and that enables people to act more effectively on the ground. The second is the data comes at the moment in weekly batches, and obviously named patient data daily would make a massive difference. So it is getting better, but we're not there yet.
In Wakefield's Trinity Walk shopping centre, one-way systems, social distancing and highly visible messages of advice are all in place. And most of the shoppers here are happy to see decisions being made more locally.
I think councils, because they know the area, whereas Boris Johnson doesn't know the area. It can go from wherever up in Yorkshire is down the south.
I think it's right. I think local authorities should have a say because every city, every town have their own needs and meeting those needs might be different to what the government are saying in London. So
okay, good. Yeah, it's good for the local community as well. And then they can put out the rules and regulation, give people more safety.
Councils in areas with higher rates of infection have broadly welcomed their newly bestowed powers, but there are still concerns that being allowed to introduce local restrictions is one thing, being able to adequately enforce them could be quite another. Fraser Maud, Sky News, Wakefield.